For almost a year now, the world has talked of one thing: the COVID-19 pandemic. What started as a reported atypical pneumonia from China has now affected the world, causing the deaths of over 1 million people. And there are projections that this number could double by January 2021. There are hopes, however, that COVID-19 vaccines in development today would gradually bring down the number of cases, the number of deaths, and get us all back to normal. But the next disease threat could just be around the corner. But there are people who've dedicated their lives in trying to make sure we're better prepared for the next one. And I'm thrilled to have with us today those two of those experts, Dr. Dennis Carroll, Chair of the Global Virome Project Leadership Board and URC Senior Advisor for Global Health Security, and Dr. Syra Madad, Senior Director of the System-Wide Special Pathogens Program at New York City Hospitals. Dennis, Syra, thank you for being with us today.
It's a pleasure. Thank you.
Thank you.
For everyone out there, you're very much familiar with Syra and Dennis today because you've seen them in the Netflix series Pandemic, which was shot just before the world was alerted with the new novel pathogen that we're dealing with today. Syra, Dennis, did you get goosebumps when COVID-19 unfolded? Did you think it would come so soon?
Syra, why don't you take that first?
Yeah, sure. So were we, I think were a number of us surprised? I think the answer is no, because a lot of us knew that these are events that will happen in the future. No one had a crystal ball in a sense of when it was going to happen, but we knew that in the world we have all the ingredients for this type of disaster. But I think what a number of us weren't prepared for was just how poorly we responded from a leadership standpoint. And we know that besides the public health and the healthcare delivery infrastructure that's needed to respond to these epidemic and pandemic incidences, it's also who's in the leadership and the governance role that also plays a big, big role. And we all have a set of foundational expectations that we build upon in response. And I think that's where a lot of us, I wouldn't say went wrong, but just couldn't anticipate that level of poor performance, if you will.
And if I could add, I completely agree that there's very little surprising about the virus itself. We knew a virus of this type was inevitable sooner than later. What really was and remains a surprise is the failure of leadership, not just in the United States, in many countries around the world. The inability to coalesce around a global event with a global response has just been staggering. And the inability to draw on really at least 2 decades worth of insight and understanding about how best to deal with a threat of this kind. There are playbooks that we have developed over the last decade that really arc out roles, responsibilities, and actions for how to deal with a virus exactly of this type. And the failure to really draw on that knowledge and to ignore it, it really is quite stunning. And that to me is the biggest surprise. The virus isn't. Our failed leadership is truly a remarkable exception to what we really expected to happen.
You talked about accomplishment by the scientific community, and I wanted to talk a little bit about the Global Virome project that you're leading. It's a mammoth project, and I know there are skeptics out there, but I wanted to ask, what's the progress with the project? And I wonder, have you been able to find the funds needed to pull this off?
Well, first, let's, for your audience, let's describe for a moment what we're talking about when we say the Global Virome Project. And it's really an attempt to change the paradigm, to move from what the global strategy for preparing for a pandemic really has to do with trying to mobilize a rapid medical response in the face of an emergent threat. And we've seen with COVID-19, that has left us vulnerable, globally vulnerable, to a fast-moving, fast-evolving virus. The Global Virome Project is basically starting from the premise that every future threat already exists and is circulating in nature. It's already circulating in wildlife, animal populations, the same way. A year ago, the COVID-19 virus we knew nothing about, but it was already existent and active and circulating in wildlife. The Global Virome Project is saying, let's make a committed effort to move our awareness, move our understanding of what future threats look like, not once they begin circulating on people, but while they're still circulating in viruses, and build the kind of database that allows us to be much more forward leaning, going to the viruses in their natural habitat, in bats, in rodents, in non-human primates, before they have a chance to spill over to us. So the Global Virome Project is about a global partnership, building a network, country by country by country, of data collection that becomes part of a global database, so that rather than understanding and knowing about a handful of coronaviruses, COVID-19, SARS, MERS, we estimate there are 4,000 different coronaviruses out there that have the potential to play out the same way what the SARS and the MERS and the coronaviruses have done to date. So having visibility on those 4,000 different viruses allows us to really understand where they are, what animals are circulating in, where they are geographically, and most importantly, it's people and their interactive dynamics with certain wildlife that enable the spillover. Having visibility on these hotspots and the high-risk behaviors allows us to think preemptively. We can prevent future spillovers. And if there is a spillover, we can detect it the moment it occurs, not after it has become an emergent threat to the human population. So that's the Global Virome Project. I have to say, there is a lot of enthusiasm for really rethinking about our future strategies for preparedness, being proactive, leaning forward, going to the viruses. We think that there is a growing commitment on the part of governments and private sector and foundations to support this way forward. And we've certainly heard from the president-elect Joseph Biden that he's committed to reinvesting the US in the area of viral discovery and re-energizing our commitment as a nation to involve the work that needs to be done to better understand viruses in their natural habitat before they come to us. So an exciting situation to be in now. COVID-19 clearly amplifies and underscores the urgency for knowing your enemy, and knowing your enemy, the virus. That is the key to being able to be victorious in any future situation that we may find ourselves in.
Dr. Syra, can you talk a little bit about the Global Health Center that you've established? What role do you see it playing in terms of pandemic preparedness?
So in the Global Health Center that, I've established here at New York City Health and Hospitals, it's called the Institute for Diseases and Disaster Management. We primarily work to help strengthen healthcare delivery systems in the preparedness and then the response, along with the mitigation and the recovery aspects of a disaster, such as an infectious disease epidemic. And so within this particular Global Health Center, we have been working with a number of different international partners like the United Nations. In fact, a team of us were planning on going to the Central African Republic to provide Ebola training to UN frontline workers in March of this year. And we had to cancel the trip because we saw what was happening in China, and we were preparing our own healthcare system for the potential onslaught of cases. And so we needed to protect, our fort, and we needed to make sure that we had enough staffing. And so a lot of my work focuses on the healthcare delivery aspect. And to give you another example, it's not enough just to make sure that we're training our frontline providers on the full gamut of infectious diseases. We need to also put tools and resources there to make sure that we are able to capture cases, something as simple as decision support tools. If you ask a given healthcare worker how many infectious disease outbreaks are happening in the world today, there's hundreds of outbreaks happening all around us. So for one individual to know what's happening at any given time, that a patient comes in with a fever and rash and they just travel to Ukraine, they're not going to put two and two together to know that there's a measles outbreak happening there and this patient needs to be isolated. And the big problem that we often see from a healthcare delivery standpoint is, we also need funding to maintain the state of readiness. So when we talk about pandemic preparedness, it's not a state, it's an active process. You need to continue to maintain the state of readiness. And so this maintenance of state of readiness requires ongoing funding. And one of the things that we have a problem with here in the United States and even around the world is we have this panic and neglect cycle. We throw in, so much money when we have a problem, and then once that problem starts to, dissipate, that money dissolves, and so we are essentially not maintaining that state of readiness. So all of the infrastructure and the knowledge and the technology that we've built, unfortunately, just basically falls to the wayside. And essentially, 4 days before the World Health Organization was notified of the cluster in China of pneumonia of unknown etiology, my colleague, Ron Klain, who's now the chief of staff to President-elect Joe Biden, him and I wrote an op-ed in the Washington Post 4 days before this notification to the World Health Organization. And we talked about this really important infectious disease healthcare delivery network that we've established in Ebola in 2014, that all of the 6,000 hospitals in the United States fell under one of these tiers. And we need ongoing funding to maintain the state of readiness. And we've done an amazing job over the past few years, but this entire program is up for renewal. Congress had no indication of actually providing funding on an ongoing basis. And that entire network collapsed. That entire network, in the middle of a pandemic, it dissolved, besides 10 centers of excellence. So that shows you one of the problems we have, not just here, I would say domestically, but even internationally, is that we don't fund preparedness to the level that we absolutely need it to. And we know that funding preparedness, while it may cost billions of dollars, it saves us trillions in the response phase. So it's really, really important to put these pieces together and understand from that particular lens.
I think we don't have much time, but I wanted to ask one quick question, and perhaps you can briefly answer me both. Dennis talked in the docu-series talked about every pandemic is an opportunity to learn. What would be that lesson from each of you with the COVID-19 pandemic?
Sure. I think from my end, the biggest lesson is, we cannot rely on bubblegum and Band-Aid approaches. We cannot rely on short-term gains. We know that these are events that are going to happen in perpetuity. They're inevitable. And so we need to look at long-term solutions. We need to look at, infrastructure that we can rely on an ongoing basis. So when the next pandemic comes, and surely it will, that we are better prepared to save many more lives, and that we're able to get out of that pandemic much, much, faster. Many people have asked, are pandemics and epidemics inevitable? And the answer is yes, but what is not inevitable is how you respond to it. So we can certainly change that.
Well, for me, I would say the take-home message is we need to appreciate that a global event requires a global response. And threats like pandemics are, if anything, global in nature. Not just in terms of the health impact. We've seen the devastating impact they've had on our social and economic situation as well. And the failure to mobilize a coordinated, coherent global response really leaves us vulnerable. And even as we struggle to deal with each nation responding, the inability of nations to reach across borders and coordinate their efforts, particularly in terms of how they coordinate access and availability of critical supplies for healthcare workers, for instance, leaves everyone in a very vulnerable state. So I would hope that as we use the opportunity to learn from COVID-19, one of the messages that we really build on is a global event of the COVID-19 type does require a well-coordinated, globally committed response. And so the preparedness needs also to have a global dimension for all of the things that we talk about, how at a given health facility, we need to be well prepared. we also need to be well prepared to deal with what are inherently regional, global events and have all of the associated ability to bring policies and practices into a coordinated, strategic, coordinated response.
Thank you so much, Dr. Syra Madad and Dr. Dennis Carroll, again, for sharing your insights with us.
Thank you.
Thank you.